Hi, I'm Dr. Seiler from Seiler Skin in Birmingham, Alabama, and I'm excited to offer the treatment called Kybella to my patients. We're going to shoot a video today that's going to show the whole process, show the ease of the process. It's a quick two-step process that involves numbing cream to get the patient's skin numb and the treatment itself, and there's really no downtime to this. Kybella is a great treatment that's made by Allergan. It's a small injection treatment that will take care of the fat in front of the muscle on the neck. Sometimes we call it the double chin. We call it fullness in the neck. A lot of people, when they do that, can really see that bulge in the neck, and they either don't like the way they look from in front or on profile. So you're going to see how easy of a treatment this is, and we'll get started. Okay, so this is step one of Kybella treatment. This is an application of a medical grade numbing cream topically. This will numb the skin to the small little injections that I do to introduce the product into the tissue. We'll numb the entire area here, and then we'll clean off the skin after about 30 minutes. She'll be nice and numb for the injections. When she's done here doing this, I'll kind of examine the skin and point out why we're doing this in her to show the fullness under the neck. If you'll bring your face forward just a little bit, and maybe a little hard to see on camera, but we'll have good before and after pictures. You can see this fullness in front of the neck muscle. This is what we call the double chin, or the fullness of the neck, or even submental fullness is the true medical term. So this is the area we'll be treating, and what she'll see is a reduction in the fat, a reduction in the fullness, and even some tightening in the neck and jawline with this. So again, this is the numbing cream to make it a very easy process, and she'll tolerate this great. And then we'll leave her here for about 30 minutes and take that off and get started with the injections. Alright, so this is the treatment phase itself of Kybella. Our patient's all cleaned and prepped. She's nice and numb from the topical numbing cream. So this step right here will actually allow us to what I actually do here is I write on the skin with a little eyebrow pen exactly where I'm going to go and all of my landmarks. This treatment is on label for the neck, and you really want to be specifically in the right treatment area and not go outside of that, because it can be dangerous outside. So what you do here is you use the eyebrow pencil to mark the lower edge of the jawline, and then about 1 centimeter down is going to be the upper limit of your treatment. And then what I do here is do a little line from the nasolabial and marionette line. That's going to mark your outer border. And then we do the same thing here. And this helps me make sure that not only do I stay even, but I stay outside of the danger zone, which is where our nerve comes up here, and that's what innervates some of the muscles around the mouth, and that's what you can injure if you go too far out. So for those of you watching this for training purposes, you really want to make sure you do this correctly so that you're safe. Then what you do is you mark the little, what we call the submental crease. You feel for the thyroid and the hyaloid cartilage here. And then we make our lower mark of where we're not going to go below, because that's where the fat pad ends. And then we're good. So this is the area right here that we're going to inject. Next, you'll see that we'll put the grid on here. This helps me stay very uniform with my injections, so that my distance between injections is the same. Even though I probably could do this without the grid, we still use the grid. And as soon as that's on there, and this is something that's very easily removed when the patient washes their skin afterwards, so this is nothing permanent. We call this a little tattoo, but it comes right off. So I think you'll be able to see from this treatment that this is pretty easy to get through. I do this quick. You do have just a little bit of burning with this. So most patients have a little bit of burning for about 5 minutes or so. It's not bad. It can scare you a little bit if you're not warned of it. So I always warn the patient what to expect, and then they're comfortable. And so you'll see our little marks right here go across. I've already kind of counted in my mind exactly where I'm going to go. So once I get started, I'm going to go back and forth pretty quickly here. You can do this too shallow or too deep, so for those of you watching for training purposes, you want to make sure that you are in the right depth, so that you're in the fat pad on top of the muscle, that you're not in the skin, and that you're not below that, so that you're not hurting anything or not ineffective. So we're going to start right here. You ready? Little sticks. Like I said, I do this quick to get this medicine in. All right. So it's relatively painless going in. You do have a little bit of burning with it afterward, but it's not bad. It goes away pretty quick. This will permanently remove the fat. And what we've actually seen, and the studies will tell you this, is that with liposuction alone, sometimes you have a little bit of skin laxity left over after you remove that fat pad. But with this, you will actually see some skin tightening. You get enough inflammation to actually cause some skin tightening. So some of the patients we've treated have actually gotten a nice tightening in the jawline here. A couple more little sticks and we'll be all done. And anytime that we have a little extra, if we didn't need all the little shots right there because we've gotten to the outer border, what I do is put just a little bit more in the area where I know she has the most fullness. Kind of spread that out a little bit. That way we make sure we get that area where we really know there's some fat pad in there. And then we're all done. You okay?
Mm-hmm.
Not too bad?
Not bad at all.
The burn-in come just a little bit?
A little bit,
on the
just
outside.
slightly.
And like you can see, this is easy to get through. We'll do a little bit of cleansing right here. We hold just a little bit of pressure. Every now and then you have a tiny little bruise with this. I treated a patient the other day that did really well. She had one tiny little blue spot and that was it. So the downtime is really minimal. And this is a really effective treatment for that double chin or that submental fat. So that is Kybella. All right, so we're about 8 minutes now out from our Kybella treatment, and I wanted to ask how you're doing.
Very well. I am feeling a little warm, full tightness feel right around in here where he injected. No pain and doing very well.
Good, good.
Mm-hmm.
Yeah, the symptoms afterward really aren't bad. It usually takes about 15 to 30 minutes for that kind of tender fullness feeling going away. Most patients don't express any burning or pain after it. You will start to get some swelling, and if you come for a consult, we'll tell you about what that entails, but it's really not bad at all to get through. Kybella is a great treatment for, again, that submental fat fullness or double chin, as we call it. A lot of people notice that on their profile pictures. Generally, patients that qualify for it, it's 2 to 4 treatments. We usually do it about 4 to 8 weeks apart. And I want to make sure that everybody understands watching this that Kybella is a great treatment, but in the wrong hands, it can be very dangerous. So I warn you, you want to make sure as a patient that you're going to someone that is an expert injector that really has a lot of experience, that understands how to use this product. You really don't want to be Googling for the cheapest place in town to get this done. This is a drug, it is FDA approved, but it needs to be done by somebody that really knows what they're doing. So not only can you get a good result, but it can be done safely. There's more information on our website at seilerskin.com. You can give us a call for if you're a patient and you want to schedule a consult, or if you're a practitioner and you want to learn about training. So thanks a lot for watching, and I hope you enjoyed the video.